Although COVID-19 patients are no longer hospitalized here, Cone Health's Green Valley campus is still home to a monoclonal antibody infusion clinic. To date, more than 1,100 patients have received infusions, and most with great success. At first glance, it's just a standard hospital room. But the monoclonal antibody treatment patients receive here is often the difference between being hospitalized with serious complications from COVID-19 and a near miraculous recovery.
When I say it's successful, what we have seen here by carefully measuring what happens to the patients who get it here at Cone is that it reduces the chances of that patient being hospitalized by about 50 to 70%. It's a huge reduction.
Scientists developed these antibodies after carefully looking at the ones produced by people who'd recovered from COVID-19. Antibodies are proteins produced by our immune system to fight off specific bacteria and viruses.
They're very specific. They know exactly what they're binding to.
Dr. Brent McQuaid, Chief Medical Officer for Cone Green Valley, says many in the medical community were skeptical of how well monoclonal antibodies would work, given they hadn't worked for hospitalized patients.
You can get to a point where you're so sick, your lungs are so injured that these medicines can't help the situation.
But for older patients with underlying conditions, the most vulnerable to COVID-19 but not yet hospitalized, the therapy treatment proved exceedingly helpful.
It's not a miracle and it's not perfect. However, there are many, many cases of folks who receive the infusion and then have significant improvement right away.
Dr. McQuaid told me the message is this: if you think you have COVID, get tested as soon as possible, so if necessary, you can be treated with monoclonal antibodies sooner rather than later.